for the Ministry of Health, and those who just, just was here in support of this event. So welcome, welcome, welcome. But I would be remiss further if I didn't talk about when we're looking for a piece of land. As an individual, I want to single out Tyrone Robinson. He was the predecessor to Laura. And where it is right now, he was able to choose this piece of land. And today we're seeing a vision exemplified. Because the vision that he had was to have a health center here, right in Rios. And today we're blessed with the work of Christopher Thompson and his Andrew Hollis administration to have a health department virtually 4 times at 2,000 meters square and what the people of Ocho have had for many years. That is a big thing. So that deserves a big round of applause to the minister and his team. And I'd like to further just speak on the Brownstone situation for just a couple of seconds. Because as you know, we just opened up a nice state-of-the-art Brownstone Health Center. But the member of parliament said that's not big enough for the Brownstone people. So we're looking at a bigger facility to serve the Brownstone people. Because what's happening in St. Anne is that the growth that we're experiencing right now is tremendous. We are producing more development in Jamaica than any other parish. So we have, in the Caribbean, that's right. And we now have to ensure that with the development that's coming into the area, we have the infrastructure to deal with the influx of individuals coming in. So health, the minister has spent so much time, and that's what I want to talk to you about, and thank him personally for the time that he has spent in St. Anne. No other minister has spent the time, other than the member of parliament here, who is Minister of Water in this constituency, in these constituencies in St. Anne, whether it be Northwest, in Brownstone here with the health centers and so on, certainly in Northeast St. Anne, which has done tremendous work at the clinic, and of course the hospital, and of course up in Alexander, right through the entire Northwest, Southeast, Southwest St. Anne. So we appreciate it, Minister. I wanted to tell you that as part of who we are and what we are. Thank you so much for taking St. Anne under your wings and providing us the support necessary. The people of St. Anne are grateful because you have done so much. You have now made essentially quadrupled the base of what we're looking at in terms of healthcare. It is so important. So there's not one thing that when people in St. Anne can say that great healthcare is right here in St. Anne. So congratulations and thank you so much. So I just wanted to welcome you all again. It's going to be a great day. It's historic. And I wanted to savor it because it will go down in the books of great healthcare for the parish of St. Anne. Thank you so much.
Thanks, Mayor. All protocols observed, but a special shout out for Minister Tufton, Laura, and Miss Lam for what they've brought to the table today. I can't help but think back to 2016, and you've heard Mayor refer to it, but Tyrone Robinson, and talking, and we said at that time, it doesn't have the reputation now, but at that time, people used to talk about the St. Anne's Bay Hospital as the Roach Hotel. You check in, but you don't check out. 9 years later, that's not the same place. But we used to talk, we used to talk about various things in the parish, and we all agreed that at some point we are going to end up in a hospital. And whether you have money or not, you might not be stable enough to fly out. So what is here needs to be at a certain standard so that when we go in, we're able to come out and we get good treatment. So it was with that Tyrone became involved with Nero, and it was with that he had this dream for what we're seeing here today. And when he first told me, I couldn't relate to it. But he persisted, kept going, and with Minister Tufton, Laura, and Miss Sams, they've worked hard to make it a reality. And they've also worked hard, not just this and what's happening with Brownstown, but plans are afoot to make St. Anne's be a type A hospital, and that's in progress. Now, if you take St. Anne, we are the largest parish in Jamaica by landmass. There are 5 other parishes that we join. We're the only parish that connects to 5 other parishes. So we're essentially the central point of Jamaica. So what I want to charge Minister Tufton with, and Laura with, and Miss Lam, is if we can now go to the next level. Many of us have friends in the United States, and we hear them going to South Korea for dental procedures. They go to Colombia for cosmetic procedures. You hear about Turkey with longevity procedures. We are prime in St. Anne for a 1,000-room Baptist or Mayo type hospital that caters to all sections of the medical field. So not only would it be fantastic for us as locals, but from a health tourism standpoint, it would probably be very successful and full all the time and pay for itself. So if it's located in St. Anne, 95% of the population in Jamaica can reach to it within 1 hour. So this is amazing. And what is happening is incredible. And what's even more touching is that our health is being put ahead of all the other tourism investments to improve the parish. We thank you, and if we now can go to the next level and find a way to do a 1,000-room Baptist or Mayo type hospital that is in St. Anne, that will be the start of medical tourism in Jamaica. Oh God, we'll be so happy. So thank you, and let's recharge our batteries and push ahead and make this other idea a reality. And oh God, when we're 80 and we have to go to the hospital, hopefully it's like a Ritz-Carlton and we can say, boy, I've arrived. Thank you.
It's always said, with good work comes more work. All right, we have the 2 MPs who are benefiting from these interventions today. And so first we invite Senator the Honorable Matthew Samuda, who will come and bring his remarks. Sorry, Minister Samuda. Sorry, I'm so sorry. Minister Matthew Samuda, who will bring his remarks, and then Ms. Crystal Lee will bring her remarks after him. Minister, please do.
Thank you, Madam Master of Ceremonies. This is a truly joyous moment, and it's a joyous moment because I'm not here in my ministerial capacity, I'm actually here in my MP capacity, and I'm very happy to be able to spend this Friday afternoon like this. Let me acknowledge colleague, minister and friend Christopher Tufton, and welcoming back to Northeast Centre and yet one more time. Also allow me to acknowledge Madam MP for Northwest Centre, Crystal Lee, who is giving some trouble over there to Mr. Peralta. Of course, Ms. Heron, I need to extend warm greetings to yourself and indeed the entire team at NERA. Thank you also, Ms. Lam. We are the beneficiaries, colleagues from Northeast Centre, of thousands of bureaucratic hours, of billions of dollars of health investment. And on behalf of the Mayor, Councillor Michael Bell Davis, Councillor Dallas Dickinson, Councillor Geneva Gordon Bailey, and indeed Councillor Isaacs, who is coming in from Kingston, had an urgent meeting. We want to say a strong, strong thank you to the team at the Ministry of Health, and specifically NERA. That's no reason to clap them. They've done a lot of work for us. It's transformational work. You see, people sometimes get frustrated looking on at the pace of development. Sometimes we have this one thing that we need for our individual community that it can become so frustrating that you create a negative outlook that you miss the fact that right around you in a circle there is great transformation. If we start the discussion at Boscobel Airport, you'd realize, Costas, that you're within half an hour of an international airport. If you come further east, you'd be aware that within a couple months, perhaps after a particular event, but it won't matter, in a couple of months, we'll be having a similar ceremony for the upgrade of the White River treatment plant for water. You come further east, and you come onto this corridor in front of Pineapple. And for those at the council, they'd be aware that we're currently in procurement to resurface the road going into the Ocho Rios area. Coming, I think, terminating somewhere near the clock, and then we're doing another stretch from NWA. So the TEF is doing this section, and NWA is doing the other section from Island Village in. You think of the bypass, and the NWA, with partnership from the IFC and the World Bank's Infrastructure Fund, is already actively designing the widening of the main corridor through St. Anne. So certainly, even this corridor will get widened, turning lanes. There'll be a new stoplight across the road very soon. So this roadway is expanding also. You go as far as Draxall, moving further west. The boulevard, as the Prime Minister calls it, will start at that point and will run all the way to Discovery Bay. That design work and engineering work is underway now, and we're going through the PIME process. You reach to St. Anne's Bay roundabout, and you realize that from a little before it, you see a new ductile iron pipe being put in, a 12-inch ductile iron pipe. Now, everything from Miami Bay to Landover will benefit from an additional 3 million gallons of water daily being pumped into that category. So I've made the point, Minister Tufton, that the health center that you're to build in St. Anne's Bay will also have sufficient water in that space. As you reach there, you'd also turn up the road and go up to Marcus Garvey High School. You'd realize that there is a mass of land that has been cleared for a new courthouse. If you turn left, you'd realize that Minister Tufton just finished the administrative block for the St. Anne Health Department. If you go further west, you realize that there is massive expansion in the housing stock. If you look a little south to where we are, there is already significant expansion of the housing stock in Great Pond going further south. If you talk to the team at JBM and UDC, they can show you exactly where we're going to be building tourism houses, where we're going to be building low-income houses, and how we're going to resolve a lot of the chronic land issues that we face. But sometimes, because you see things happening in a haphazard way and nobody stitches it together for you, you don't realize that if you're living in St. Anne, if you're living in Northeast St. Anne, specifically Miss Claire, if you're operating from Pineapple, you're in the center of the national transformation. You're seeing the vision of prosperity actually come to life. And what is impressive is that the projects we're discussing are not backed by debt. This is being undertaken from your tax dollars. These sorts of discussions, even to have the discussion, we used to have to borrow the money to do the engineering, to do the design. That's no longer where we are as a country, and sometimes we don't understand. But the transformation that you're seeing in health is being mirrored with the transformation that you're seeing in education in the area also. We'd have known that we completed the of shift this year. We know that we completed the construction work at the Ocho Rios Primary School and took it off of shift this year. And going to graduations, you're already seeing the impact in the grades of the students from being taken off of shift because teacher-student ratios are shrinking. Transformation. So there are projects that are moving a little slower. There's no doubt about that. But do not be disheartened that those may take a little while longer, because if you look to the east, there is growth. If you look to the west, there is growth. If you look to the north, there's beautiful Caribbean Sea, but certainly if you look to the south, there's growth. So Mr. Clare, I assure you, because of where we're standing, that we are working on your project across the road.
Thank you very much, sir.
We are working on it. And in the way that this took Minister Tufton, myself, and Mayor Bell Navis dozens of hours to follow up with NEPA, the Parish Council, NWA, NWC to make sure the permits were in place so you could break ground for today. I assure you we're putting thousands of hours behind the varying projects that are required for this area. When we look at what is happening in Northeast Centre and we look at the transformation of areas like Steertown, it is well known that we have other areas to transform as well, Councillor Bailey. But we assure you here that your government is very focused. It is actively working to improve the issues that we face. And you have a strong leader in our Prime Minister that is committed to fixing the issues that have been there for some time. But today is a phenomenal day for us here. This allows the continued growth of the town of Ocho Rios. This sends a signal that we're committed to projects like the new craft market. We're committed to projects like fixing up the actual market in Ocho Rios. We're committed to the widening of the Draxall corridor. We are committed to completing our schoolwork in St. Anne's Bay with the St. Anne's Bay Infant School, which we expect to get underway later this year. Ladies and gentlemen, sometimes if I don't keep a list, we forget all the projects taking place in this area. We're thrilled for this one because we know it allows those other projects to happen. Because if you don't have good health care for your citizens, none of the rest of it will matter. But I do agree, Joey, we want to get to the point where people from other parishes, people from other countries are coming to Northeast Centre. And instead of ordering flowers, perhaps they go across and get a nice gift for those who are in the hospitals, Miss Clare. But ladies and gentlemen, proud day. I want to put on record my continued thanks to Minister Tufton. We like when he visits, he comes bearing gifts. So we wish him continued visitation to the parish of St. Anne, right, MP Lee? And we look forward to what is to come. Thank you so much.
Thank you, our lovely Masters of Ceremony, Mrs. Nadia Nunes Hyde, our Parish Manager, right here. Allow me to greet, ladies and gentlemen, our Honorable Minister of Health, Dr. Honorable Christopher Tufton, my colleague, Mr. Matthew Samuda, MP Northeast St. Anne, Mayor of St. Anne's Bay, Councillor Michael Bell Navis, Custos Rotalorum Joseph Issa, Mrs. Laura Heron, Board Chairman of NERO, other members of the board who are present here with us today. I'm seeing former Member of Parliament Tarn Peralto, our Manager of SDC, Mrs. Hilary McBain, who I'm sure assisted in mobilization, and of course our councillors, Councillor Dallas Dickinson and Geneva Gordon Bailey, and our hard-working and accessible Minister. I must say, Mr. Clark is extremely accessible. He answers and responds at nights. So we like that. Mrs. Lam, I've had the pleasure of working with you for a number of years, and I know that you're a very hard-working regional director. And once again, it's always a pleasure cutting ribbons and breaking grounds, once again. So, ladies and gentlemen, pleasant good afternoon to you all. Good afternoon. As Minister Samuda mentioned, I am extremely happy to be here this afternoon because as a youngster, I decided, well, I'm still young, yeah, I can say youngster. I decided to go into politics because I didn't want to be one who stands on the outside and complains without doing something about it. I remember, it's very touching for me, both of my parents would have died in the St. Anne's Bay Hospital, and every time I talk about the experiences, it really brings tears to my eyes. So when I hear people talk about certain things, I know what they're feeling. It's just that I decide that I want to spend my life making a difference. And I want to say, Minister and the team at NERO, I'm extremely proud that having been a part of the board of NERO for several years ago, having seen where especially this particular health district, St. Anne district, is coming from, this is a very proud moment. Round of applause, please. I've never seen in my lifetime the amount of investment in healthcare that we're seeing now. In Northwest Center in particular, right now we have 2 health centers being currently renovated. We have and I must say, Ms. Nunes, on becoming member of parliament, she would have sat with me and we spoke about several things. And everything that we have discussed, what was needed, we worked towards that. And they are now being executed. Now we have Mrs. Sarah on the Bamboo Health Center currently being rehabilitated, state-of-the-art health center, approximately $100 million. Round of applause. Thank you. I'm very happy. Right now under the Operation Refreshers program, we have the Runaway Bay Health Center being currently renovated. And though it's a temporary space, because just like Brownstown, and Minister, this is when I'm going to say now, right, that I just have to ask for something just like Mr. Issa did. Right? So even though you're renovating the Runaway Bay Health Center, and we're very happy, Mrs. Lam, that the designs for the new health center have been submitted to the municipal corporation, and I was told that the land has been, acquired and all of that. We're looking forward to the new Runaway Bay Health Center very soon, because as Minister Samuda spoke about the development, we are looking in Centre and Northwest for 4 major hotels coming on stream in addition to what we currently have. We're looking at consistent housing development just going up, to the point where we are getting a new school. The Minard STEM school, the designs for that school should be completed by the middle of July. Because we are, our schools as it is now, they are crowded. Because we continue to develop along that stretch. And as government, as Minister Samuda explained, everything has to work as one unit. So we're improving in healthcare, we're improving and increasing in education and spaces and making that available. We're going to look at the road and of course, Minister explained on the water infrastructure. So big things are happening in St. Ann Northwest, big things are happening in St. Ann. And I'm particularly pleased, Mrs. Lam, for what is happening from Nero in the constituency of St. Ann Northwestern. Right now, I know too, the Queenite Health Center is down to be done as well under the Operation Refreshers program. So as soon as Runaway Bay is completed, I was told by NHF that we will then look at Queenite to have that community center renovated. Now, as Mayor mentioned earlier, everybody thought when Minister came a couple of months ago, Ms. Nunes, to do that lovely opening for the temporary health center at Brownstown, in which they're well pleased, by the way. They thought that was it. And when they heard that that is really just a temporary space, right? And they learned of the new health center to come, state of the art with all this increased amenities and services and everything that is coming with it. I must say my constituents are extremely happy. Back in the days when a government would have made commitments and you can't see it happening, we are seeing everything unfolding now right in front of our eyes. So it's not just talking, but putting your action and shoulders to the wheel. And we're very grateful for that, because it's not long ago we built that temporary health center, opened it, and right now we are about to start the new one. This is a very proud moment. So yes, some things in government may take long, but we are proud of how quickly we're seeing the transition taking place for the new Brownstown Health Center to come on board. So I just want to say on behalf of our constituents, we want to thank all the stakeholders, all the agencies, the Ministry of Health, the Minister, the Regional Director and their team, the Board of NERA, all those who assisted in ensuring that these projects are a success and they're properly executed. We thank you very much and we look forward to our continued work with you. Bless you.
Thank you, Minister Samuda and MP Lee, for your remarks, reminding us of things to come, things that are in progress. As you think about what you have heard, I invite Ms. Anne-Marie Hudson, Community Health Aide, St. Ann Health Department, to bring us an item. Let us make her feel welcome, please.
Good afternoon, everyone. And how are we feeling today? Good. That is good. While I was searching for a song to perform today, my 7-year-old daughter said to me, Mommy, you can sing Win the Battle, you know. Because, you know, you win a lot of battles at your workplace. And I had to look in it this morning. Because with this health system, we're able to fight the battles of diabetes, hypertension, strokes, mental illness, and other illnesses. Today, we are going to win the battle. Bless the Lord. Just waiting on the musician. This world is not my own. I'm just passing through. With no battle someday. This world is not my own. I'm just passing through. My treasure's always waiting somewhere beyond the blue. If heaven's not my home, then Lord, what would I do? My mama always tell me, God loves you. And I wish that I would win the battle, win the battle, win the battle someday. And I knew that I would win the battle, win the battle, win the battle someday. Each morning that I rise and open up my eyes, I thank the Lord for keeping me all through the night. Each evening when I lay my head upon my pillow, I ask the Lord to guide me and provide for tomorrow. And I wish that I would win the battle, win the battle, win the battle someday. And I know that I will win the battle, win the battle, win the battle someday. If I reach out to the one who made the heavens, who made the seas, who made the birds and the bees, I will win the battle someday. And I know that I will win the battle, win the battle, win the battle someday. And I know that I will win the battle, win the battle, win the battle someday. I wish that I would win the battle, win the battle, win the battle, win the battle someday. And I know that I will win the battle, win the battle, win the battle someday. Win the battle, win the battle someday. And I know that I will win the battle, win the battle, win the battle someday. By the blood of Jesus, I prevail over sickness. By the blood of Jesus, prevail over sickness. I prevail, I prevail, I prevail, I prevail. Yes, I prevail. Yes, I prevail.
Of a certain, many hours spent bringing this to fruition. I'm sure that many battles have been won, and of certainty we are prevailing. Mr. Orette Clark, Program Manager from the HSSP, will now tell us about the future Ocho, Rios and Brownstown District Health Centers. Let's make Mr. Clark feel welcome.
Thank you, Madam Masters of Ceremony. Dr. the Honorable Christopher Tufton, Minister of Health and Wellness. Minister the Honorable Matthew Samudo, Member of Parliament for St. Anne East. Ms. Crystal Lee, Member of Parliament for St. Anne's North. The Honorable Joseph Issa, CD, JP, Custos Rotolium for St. Anne. His Worship the Mayor, Councillor Michael Belnavis, Mayor of St. Anne's. Mrs. Laura Aaron, Board Chairman, Northeast Regional Health Authority. Ms. Fabia Lam, JP, Regional Director for Northeast Regional Health Authority. Dr. Patrick Vito, Regional Technical Director for Northeast Region. Other members of the Board of Directors, management and staff at Northeast Region and the St. Anne's Health Department. Ms. Laurie Henry, Director of Pharmacy Services for Northeast and Trelawney. Representatives of the Jamaica Defense Force, Jamaica Constabulary Force, and the Jamaica Fire Brigade. Representatives of the Minister of Finance and Public Service, the Planning Institute of Jamaica, the National Health Fund, the National Environmental and Planning Agency, the Social Development Commission, the St. Anne's Municipal Council, and other public bodies represented here today. Representatives of other regional health authorities, residents of Ocho, Rios, Brownstown, and surrounding communities, members of the media, other specially invited guests, good afternoon. It is my pleasure and privilege to be here in St. Anne to not only speak to you about the future of these two facilities, but it's also here to help you visualize what these facilities will look like and feel like, and for your dreams to become a reality. These two projects, they represent transformation in healthcare. So let us begin right here in Ocho, Rios. Look around you, the ground beneath your feet, the space you are seated in. This land holds great potential, and this is where it all comes to life. Soon this open lot will become a place of comfort and care for more than 30,000 people in and surrounding communities that will serve the future of Ocho Rios Health Center. So now just take a walk with me in the future. I just want you to close your eyes just for 1 minute and imagine walking through the entrance into a wide waiting area that is clean and well organized. There's room for everyone to sit comfortably. There's even a shaded veranda area for those who prefer to wait outside, surrounded by fresh air. When you go to the registration area, you don't have to be shouting anymore through a little glass window. Instead, you walk up to a registration area that values your privacy with multiple stations that give you space and dignity. Past that, there's a modern state-of-the-art pharmacy with enough windows, with enough medication just to serve you within the stipulated 15 minutes time from the NHF. Everything is really in place. Maybe you're just at the health center, just a routine checkup, or maybe something more urgent. Either way, you're met with a full team of doctors, nurses, midwives, community health care workers, all the health professionals that you need, each serving you from a clean working area with well-lit rooms designed with real patient care as well as their own comfort and well-being in mind. In one area, you'll find dental suites with proper sterilization rooms. In another, there's a sterilization room and a separate space for asthma patients to receive urgent attention right when they need it. Every service you expect is here, as well as some that you may not expect, but you will be thankful when the need arises. This is the future of Ocho Rios Health Center. We anticipate construction to begin in very short order, and it will be completed within 16 months. Upon completion, the HSSP will work with NERO to provide all the necessary equipment and furniture to support the preparation of the staff who will serve you here. Now just let us teleport over to Brownstone. Have you ever been up there? You'll know that though it's a rural community, it is full of life. There's the school traffic in the morning, the market in full swing by midday, and the steady flow of people dropping in health center to take care of their health. As Ms. Lee stated earlier on, the Brownstone is already getting a taste of what the future is, as this health center has been temporarily relocated to the Brownstone Community College in a space that has been retrofitted by NERO and HSSP at a cost of over $80 million. Though this is a temporary site, it is more spacious, comfortable, and accessible than the original one. And guess what? The HSSP won't stop there. In another 16 months, the new permanent facility will replace the existing dilapidated building. Like Ocho Rios, this space will also include a pharmacy, treatment areas for mental services, maternal and child health, also with laboratory and dental services. Now, ladies and gentlemen, let us return to the present moment, because not all our improvements are in the future. The work of the HSSP doesn't stop here. It doesn't stop at concrete and equipment. Some would say block and steel, some would say hard goods are hot. But this program is about transformation and change. Our health centers currently, they are digitally connected. We have implemented over the last 12 months an electronic health record system in both Brownstone and Ocho Rios Health Center. This allows for better patient tracking, faster service, and safer, more coordinated care. All these upgrades support something called the chronic care model, which is the foundation of the health system strengthening program. The chronic care model is a framework for providing care in the healthcare system in a very holistic way, particular to patients who are living with or at risk with non-communicable diseases such as diabetes and hypertension. This model of care is being piloted under the HSSP and is aimed at ensuring these patients receive coordinated, team-based support for the moment they walk through the door. We know that change is more than construction, and so we are here to guide the future, not just to build it. To support this, we have dedicated communications, change management, social and environmental specialists as part of our team. We will continue to engage residents, provide updates, and ensure we are listening as much as we are planning. And as I said to Ms. Lee, we are here to serve, so we'll be accessible even at 9 o'clock in the night. So if you have any questions today, please stop by the change management booth at the back of the tent. Cordell and our change agents are there to speak with you. Earlier today, our social specialists held a community sensitization session to share updates and to hear from our Ocho Rios residents. Another session is now taking place in the Brownstone. And for a person who cannot make it to these events today, we are sharing updates live on IRFM all day, and we have more of our valid media partners here now to ensure that the community members are informed. We are doing all of this because this is not for us alone. It is for you. Talking about the father picking a prescription after school, the grandmother checking your blood pressure before heading to church, the teenager looking for answers in a space that feels safe. You are who we build for. You are who we serve. You are who we walk through the doors of these new facilities when they're open. You'll not only be walking into the buildings, but into a better future of healthcare in St. Anne. I also want to thank the entire team who has made this thing possible today. We're talking from the Municipal Council, other statutory bodies, our HSSP team who has put in all this effort from the procurement process up to contract signing. The team that has implemented the electronic health records in St. Anne. I have to thank them for what they have done so far. Today, we also look not only to break ground, but for the continued partnership with the NERA team as we build this future together under the Health System Strengthening Program. Ladies and gentlemen, thank you.
Thank you so much, Mr. Clark. We are inching closer to the contract signing, but before we get there, I invite our Minister of Health, Dr. the Honorable Christopher Tufton, to give us the keynote address. Let's make him feel welcome.
Madam Chair, I want to thank you first of all for accepting my little bit of nudging to run through the program very quickly. And by the way, she is accustomed to being chair at all these events, and she does an amazing job. And I want to big her up. She's a parish health officer, parish manager, sorry, and truly a committed public servant. And she, in keeping with the tourism culture, Costas in this parish, always a great host. Costas, good to see you, sir. And since you're in businessman and Costas, I would advise the break ground for the health tourism hotel, and we'll work with you on it. I know you know the tourism business, you know, so we're gonna challenge you to lead on it, okay? So we can speak more later on. Let me just welcome all who are here. There are so many, I won't mention everyone, don't be offended. After, of course, recognize Costas, have to recognize the parish, the regional health team represented by our chair who spoke earlier on, Laura and Fabia. We know each other a long time, so we're on first name terms now. That's how much we're a family, right? Ms. Laura Heron. Let me welcome also the political representatives here. My good friend Mike Bell Davis, who is the mayor, who says so many glowing things about me. I wonder when he's going to invite me down here for a curry goat feed, or maybe a weekend for two, or for one, as the case may be. But he's always available, I know, so I'm pulling his leg a bit. But thank you very much. Other councillors who are in the audience, and the two very hardworking councillors from Miss Crystal Lee. Where is she? She gone? Oh, okay. Oh, she's around the back there. Okay. You know, wherever she is, I know she's active and busy and always willing to work hard, so I want to just recognize her. She's out of Minister Montague, well, should I say, MP Montague's stables. I don't know if you know, she was a councillor. And last week I was in retreat with MP Montague, and I come soft soap me up and tell me how great I'm doing. As I sit down, so him start asking for more money to do more. The difference between her and him is that she do it at the platform. He just whisper by ears, right? But always representing our people, and for that we have to give our commendations. Very well done. I want to recognize my friend and colleague, Minister Matthew Samuda. Yes, we see each other a lot in this parish, and normally with a lot of goodies. And both he and the Member of Parliament, Crystal Lee, have to take credit because they lobby hard for the people of St. Ann. And that's really where it starts. If you have a good representative, it works. And I must tell you, sometimes I'm kind of tired to hear them because they're always a talk on your behalf. So I want to big them up. And I'm saying it because it's now the season to compare and contrast. Everybody get the gist? Sorry, I have to do it, right? So just bear them in mind whenever you're doing your comparisons, right? I am going to be very direct over the next 7 to 8 weeks. Because the people have a choice to make, and they must make the right choice. Am I wrong or right? Other people direct, I can be direct too. I am still going to look after everybody. But when that time comes, I'm going to defend those who I am very comfortable with. And I want to thank the 2 members of parliament. And they work hard, they work hard, they work hard. You to mayor, but your time is not right now. You have a long time to go, right? So I want to just recognize the contractors who are here. They know themselves. I want to recognize the health team. Those ladies at the back in blue and brown are my favorite people in public health. Now I tell you, I say it every day, no offense doctors, no offense hospital clinicians. Those are the ones who go out in the field every day. The midwives, the public health nurse, the community health aides. They are the army on the front line. And let me tell you something, they do an amazing job. They go into the homes, they help the old lady there, they help them to take the medication, take their blood pressure, and just it goes on and on. And I have always respected that work. And I respected it more coming out of COVID because without them, mortality rates would be a lot higher. They were the purveyors of COVID protection, and I want to just recognize them in the audience. Everyone else, you are equally important as part of the community. I want to make a couple of points. First of all, good things are happening in public health. And it's important that we see the progression, we see the progress. Today it's about $818 million new Ocho Rios Health Center. And in the past, we don't build health centers for $800 million, you know. I want people to understand. We build health centers for 50 and 40 and 30 and so $million. An $800 million health center means a proper health center. It is new and different. It is high tech, or it gave all of the features. And it means, therefore, better service for the people on the ground. We also have a $718 million health center in Brownstown, hence the presence of the representatives of both communities. Combined, you're looking at 1.5 or so billion Jamaican dollars worth of health center and equipment. In addition to that, it means more doctors, more nurses, more services. You know, more services. You don't get it, right? It's hard. I'll tell you another time. More services. Now, that is a very positive thing. It's a very positive thing. Now, I hear people criticize groundbreakings. You right? And again, it's a season to compare and contrast. We're not going to overdo it. We have to make the point. How can we criticize progress in the community? It's not a good thing. And remember now, these are not commitments to achieve in the future. These are things we are doing now. Monies are allocated, contract is signing, groundbreaking is taking place, cranes are going up like Spanish Town Hospital, workmen are on the ground, which will result in a value-added product for the benefit of the people. How do you criticize that? How do you criticize that? And I want to make another point because I think it's important, worth making. Because the Honorable Prime Minister has been doing a lot of groundbreakings. That's true. A lot of groundbreakings. I've been doing a number of them. Matthew is doing a number of them in this area of water. Other ministers are doing it. It needs to be identified that there is a difference between the development cycle and the political cycle. Things do take long to happen when you start an administration. We 9 years ago. And I give you the example of this very facility here that we're breaking ground for. When I became Minister of Health, 6 months after becoming Minister of Health 9 years ago, I traveled to Washington to start negotiating on the health system strengthening program as we know it now. Negotiating a loan arrangement, then negotiating with the EU for a grant to be added to that, then securing GOJ funds, because those are the 3 sources of funding under this program. 9 years ago, we're breaking ground today, 9 years on. And it's not for a lack of effort, because trust me, we have made the effort. I don't sit down on my laurels when I have work to do. When I get a job to do, I deal with it and finish the job. That is my history, that is how I grew up. But we were along the way. It took a lot of different levels of bureaucracy and consultations. Now in fairness, which many people forget, COVID interrupted us for 3 years. So we probably could have started 3 years ago, which would be a relatively good timing, but it would be literally after the first term of the political cycle, because elections are held every 5 years, but of course, traditionally, it's normally about every 4 or so. So what you have then is a project, substantially game-changing project, that starts just as you become minister. And 4 years on, you're still weighing through the paperwork to get the groundbreaking, as the case may be in this instance. It can be frustrating. It can be frustrating. And it's something that as governments we have to take on in a serious way to find ways to make things happen faster for the people that we represent. Otherwise, when the political cycle comes, even though the development cycle is longer, what you end up having are people saying, well, you never do this and you never do that. We are lucky in a sense that we had the second term to continue. And what we are now benefiting from, which is the upside, which is why I say we need to celebrate, is that we have continued, we have stayed the course, we have labored hard, we have negotiated even in the face of crises like COVID to continue the development cycle. And that development cycle is now yielding results today. And we must be happy for it, no matter which color of the political divide we are, because sickness is no respecter of persons. When it comes to health, whoever you are, whatever color you wear, whatever position you take, don't watch me. Of course, I defend my position. But the truth is, me not turn anybody back. And we have helped all persuasions and no persuasions at all. And so, when groundbreakings take place, when the Prime Minister break ground for a water system, or a BPO, or a sewage system, or a hospital, the country really ought to recognize it as a good thing. And those who don't, we need to enlighten them as to why it is important. And I think that's very, very important. So today is a good day for us, and I'm happy, even while I accept that things have taken long. But it also shows that our determination is there, and that we're moving in the right direction as a country. Minister Samuda, MP Samuda, gave a really nice shortened rendition of all the things that are happening in the parish of St. Anne. And you know, one can't help but thinking that this is the first time post-independence that St. Anne has gotten so much attention in terms of holistic development. Water, housing, health, hospital, roads, sewage, schools. I mean, it really is a good time to be living in St. Anne Parish. It really is a time when everybody should be looking up and should ensure, as I say, that we stay the course, because it's going to augur well to every single one of us. And that's really what it's about. Life is about happiness, contentment, pursuing your dreams, feeling safe, and just living to your true position. And we want to ensure that health follows development. Health enables development, and therefore we won't be left out. Hence why, over the past 5 years, including these 2 projects, we are spending about $3 billion in this parish for health infrastructure and counting. I have a list of the hospital, the health centers and other institutions here. Well, I had it. I think Matthew have it down there if you pass me those papers. And I think it's important for people to get a perspective on all the areas that we have spent resources on. Claremont, we have done 17 million, a lot of different upgrades. Steertown, 10 plus million, Monique, 22 million, St. Anne's Base Health Center, 124 million, Brownstone, 84 million, St. Anne's Bay Health Department, which we opened recently, 400 million, because staffing is important. Regional Health Maintenance Unit, 97 million, St. Anne's Bay Hospital, well over 150 million, Alexandra Hospital, 380 million, Bamboo Health Center, 60 million, and I could go on and on. That's a good thing. And that's something we need to celebrate. We need to see it as part of community development. And we need to enjoy and embrace the changes that are taking place. And this is why I think today is indeed a good day and a time to recognize that we are moving in the right direction. I want to close by commenting on something that's not as pleasant, but I think it's worth linking primary health care to the issues around maternal mortality. First of all, it is very sad that we have had the recent announcements around the increase or unusual numbers at the Victoria Jubilee Hospital. I have not commented as much on it, but I am equally concerned as Minister. I've allowed the clinicians, the Chief Medical Officer, the Regional Health Authority, and the Regional Technical Director, who have primary responsibility for this issue, to brief me based on the technical consultations that they have had. I know it's a silly season, or it is the season to compare and contrast, and therefore I didn't want the issue to become a political issue, because lives are at stake, mothers are involved, their emotions, their feelings, and we need to show support, empathy, and give the matter the consideration that it deserves. As the Chief Medical Officer has said, this is an issue that relates more to premature birth and effects related to that, not to an infection or any infection in the institution. That's what the report says. That's what the Chief Medical Officer is on record of saying. And it's an important distinction, because we have tried to learn from the lessons of the past. While we can be critical, whether self-critical or absorb criticism constructively, we must also be willing to learn from mistakes of the past, maybe recalibrating the protocols to improve from the past. And so that's the approach, and I think to a large extent those lessons have been brought on board, certainly by the regional authority, and in this case the particular institution. But there are other challenges that we have to confront, and where is the link to primary health care? Because of the 325 health centers across Jamaica, these two that are going to be constructed being two of the most modern ones, or will be, maternal mortality, let me break it down, caring for expectant mothers and their unborn and later born child is the core, or certainly one of the foundations of primary health care. It means that those nurses in brown uniform and those community health aides and the doctors who support them, part of their core responsibility is to ensure that our mothers are taken care of. And for the most part, they have done extremely well. But there are some challenges that we're going to have to confront in a more substantial way. I'm linking it back to what has been identified, at least preliminarily, as the cause of these surge, that's this particular surge at Victoria Jubilee. We have a society that has to manage, and primary health care is key to this, more lifestyle-related illnesses. Because there is a direct relationship between lifestyle, our nutrition, our physical activity, what we do with ourselves and the decisions we make, and how it affects us as a person. And in the case of a expectant mother, it also affects, of course, the unborn and later the child. And the studies are there, the clinical studies. And what we have to do is to reach out more to provide greater support. And we want to encourage our pregnant mothers or pregnant ladies to present themselves and to provide or benefit from the guidance that the system has to offer once you know that you are expecting a child. The data suggests, that I spoke to it in a sectorial before this incident took place, that in 2018, only 22%, let's say 3, let's bring it up to 3, but it's really 2 based on that. 2 out of every 10 women who are expecting a child turned up in their first trimester, the first 13 weeks of pregnancy, at a public health entity to be examined and to be given the appropriate guidance. Today in 2024, as a result of the work that we have been doing, 40%, 4 out of every 10 expectant mothers turn up for that kind of support in their first 13 weeks of pregnancy. That's an improvement. We have seen maternal mortality, which peaked, unfortunately, during COVID, the 2021, of about 200 per 100,000 births, which is high and concerning, come down to today, last year, to 130 or thereabouts per 100,000 births. We really need to get that down to about 70 or 80 based on the World Health Organization standards. So we have work to do, but we're moving in the right direction. But when you look at some of the risks that contribute to high-risk pregnancy, we have to be concerned that we have to educate, inform, and encourage our families, mothers, their partners, to seek help early, at least to ensure that they are experiencing a normal and healthy pregnancy. Because when I look at the data as the major causes of high